Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. Directly to high performers who are tired of running on empty but don't know how to stop. Dr. Mel is a naturopathic doctor, protocol developer, and clinical trainer with over a decade of experience helping individuals break out of survival mode and back into real sustainable health. She's the creator of the Biohacked Heart Blueprint, a system designed to connect nervous system regulation, cardiovascular health, and metabolic function. Because masking symptoms and suppressing numbers doesn't fix what's happening underneath. Root cause medicine does. Through her hybrid practice in Scottsdale and immersive retreats in Sedona, Dr. Mel works with leaders who are ready to take the armor off, reset their system, and rebuild from the inside out. With real science, no guesswork, and no more white knuckling through life. So if you've been pushing hard or for years to know something deeper needs to shift, this conversation is for you. Welcome to the show, Dr. Mel.
Thanks for having me, Ginger.
We're super excited. So you do something that's pretty unique, and we're excited to talk about it. But before we get into that, since the podcast is for clinicians mostly, we'd love to hear a little bit about your professional journey. What led you down this path? Kind of give us a brief overview of the training path that you chose.
Yeah, so I'm a naturopathic medical doctor. So I went to a naturopathic medical school, and life kind of shaped me to go there. My mother died of cancer at 33 years old. I was 11, and as everyone knows, no one just dies of cancer. It's a journey. And as a kid, I didn't know anything, but I knew that she just kept getting sicker with each treatment that she did, until it eventually, from my point of view, killed her, right? That was a ticket for me and my brother to get out of the household that we were in Alaska, and move to Mexico, where our father was. And our father was clueless, obviously, but he was a health nut. And so there was a connection of losing the mother to a serious illness. And then my dad was a health nut. And of course, we just thought he was weird, kids, right? We're like, what are you doing, Dad? You're drinking juice for 10 days, right? And but I have a son, and he's 22 now. And so when I got pregnant with him, I realized that there was something there, right? Like, I didn't want my son to not have a mom like I did. And I thought that maybe my father actually knew what he was talking about, and I needed to sit down and listen. And that's what kind of started this journey for me, right?
Oh, very cool. You are based in Arizona, right?
Yes, Scottsdale, Arizona.
Very cool. And you kind of specialize in cardiovascular and metabolic and all of that cool stuff.
Yes.
So let's talk about, what are the most common root causes that you're seeing in this patient population, and how do you address them?
Conventionally, we've been distracted, right? By just focusing on squishing down the cholesterol, or just squishing down the blood pressure with a med. And that's kind of it. But what I found is those are more kind of like at the end of what's happening. And the causes are usually chronic stress. Even if you're not, angry and yelling at people, I love that. The people around you love that, but there might be a lot of mental gymnastics going on all the time. So that's a big part of it. And there are the hotheads too. I find there's two types. There's the stoics and there's the hotheads, but the end result is kind of the same. We're stacking, plaque basically, and arterial damage. And what happens is, through modern living and chronic stress, before we even put anything in our mouth, we're raising our glucose and our insulin, because that's just the natural pathway in the way that the body works. And then, of course, none of us are perfect, and we all have blind spots. So then we are, eating in ways that are raising our glucose and our insulin. And that's what's leading to the higher blood pressure and the higher cholesterol is this stuff more in the middle.
So it's a combination. Mm-hmm. Can you explain to me, like, as a layman, and I'm sure the clinical people listening would benefit from hearing this as well, but in your opinion, like, let's talk about this chronic stress because, it's pervasive in our society, right? Like I work really, really, really hard on, looking at the ocean and going into nature and,
Yes.
doing my meditations and stuff like that.
We're thinking about this stuff, right? And if we really step back, we could say it's mostly in our imagination, right? It's not like this is something that you need to fight or run away from, in traditional physiology, they have the fight or flight response, but we're having these hormones that make our body think we're in that situation. So one way to think about it is your well-meaning liver, which you could kind of think about as the supercomputer, of the body, is saying, oh, I feel like we're in a dangerous situation. I'm feeling a lot of cortisol, a stress hormone. So I'm going to pump out some glucose to go to the muscles so we can book it out of here. Like if you just wanted to boil it down, that's kind of what's going on.
So cortisol is the big player in all of this.
Yeah. And then cortisol can kind of go with adrenaline, which I believe maybe is fun if we're ziplining or surfing or something for like a small period of time. But a lot of us have been living for literally decades on cortisol, adrenaline, and dopamine hits. And that wasn't meant to be a sustainable way of living.
And isn't that a societal kind of norm now?
Oh yeah. I mean, that's the thing, right? That a huge thing is like, I love the internet and access to all this information. I'm sure you remember growing up, Ginger. I used to just wonder how you did things and wonder if I would ever find out,
Right. Now we have it all at our fingertips.
Like through the World Book encyclopedias, I mean, it was very limited, like the reach of information, that we had. But at the same time, it's got these dopamine hits like crazy, and you see it with the little kids that get addicted to the iPads, but the same thing happens to us, right? And a lot of people, I would say at least 50% of people, they're not sleeping well. I mean, I don't know how many people I talk to that they've been sleeping 4 hours a night for decades. And that's just become their norm. And that's not allowing this healing time for the body. And so specifically, if you're one of these people where you're not a great sleeper and you haven't been getting your 8 hours for decades, you've got to be your own toddler and limit this screen time stuff for real.
Yeah, I just thought about all the people that I know that are struggling with that particular issue. All right, so let's get into it. So you're dealing with high performers. They're coming to you because, just some of the things that you just covered. What are the labs? What are the diagnostic tools that you are finding are most essential to uncovering these imbalances in your patients?
Yeah, so a lot of them will come because maybe they got a high cholesterol, like on a basic screening, or they're trying to be proactive, and then they found that they have plaque in their carotids or this high calcium score. And usually, if it's not a personal history, there's this close family history, and then we're getting older and we want to be more proactive, which I love that. But I find that we're missing a lot. Like the general screening isn't giving us a lot to work with, right? So right. This is one of my big things. I think on all general screenings for everyone in America, we should start adding a fasting insulin. Because that would help us get ahead of things before, we wait for things to become pre-diabetic and diabetic and be causing more damage to the cardiovascular system, because the numbers are not fun, but it's something like 80% of Americans are insulin resistant. So there's a high chance that we are. So that would be the first thing I would add into labs. And then more of these inflammation markers. And the great thing about those is, so we see it, and if we don't like what it means, we can use that as a pivot point, but these things can actually give you feedback in just 6 to 8 weeks in your lab. So then you can feel better, but then go back and look at your numbers and get that positive reinforcement. Like, yes, I'm turning this around. I'm moving in the right way. So then you get that encouragement to keep these new lifestyles. And all of this can be mostly done with lifestyle, very... Right. I never use medications. I mean, it's very rare that I would use a prescription medication, And then a cool thing, I don't know if you've heard about it, is Clearly. Mm-hmm. So Clearly, so my folks that like numbers.
Oh yeah, I think I have heard of them. It's a scan that they.
Yeah. So this would be better than like your calcium score or CT scan, right? Because
I have heard of it.
They're going to take your scan and they're going to put it into an AI software, and it's going to tell you for each artery that goes around the heart, how much, not only how much plaque is in there, but what kind of plaque. So you have an idea of like how dangerous or stable is this situation. And so that's going to give you more information, because even with the, the calcium score, the plaque score, it's not giving us a full picture. Just like the cholesterol, like, oh, your cholesterol's high. Okay, well, what does that mean? Because there's certain cholesterol markers that are sticky, and we want to know about them and maybe make certain adjustments for that, and it gives you a fuller picture. So I'm really encouraging the people that are up for the CT scan, because some of my clients, they won't even do it, right? They don't want the radiation. They don't want anything to do with it. But the data does help us take action, because we can put things off forever, Oh,
Right.
I'll do that later. Oh, I'll do that after my kid's graduation or whatever. So sometimes the data is really good, because we do need to light a fire to take action.
Gotcha. Can we talk a little bit about the insulin fasting that you mentioned?
Yeah.
What is that about, and how do you do that?
So that's just a lab test, and you should ask for it. And then what I hear from people, is that they'll try to talk you out of it because your insurance won't cover it. It's like, it's probably going to cost you like $20 at the most, So I would be like, just send me a bill, right? Because it's going to give you a lot of information, and that's going to show up before pre-diabetes, before type 2 diabetes, and the further upstream we are, the easier it is to turn that around, right? The other thing is, once you get it, if you get it, you're lucky you got it ordered. Do not pay attention to what they say the normal range is on the lab, because it's going to say like a very insulin resistant range is normal. Well, probably because everyone's insulin resistant, but it's not ideal, So
Gotcha.
what we want is less than 5 on the fasting insulin. So they'll tell you 20 to 25 is normal. That's really insulin resistant. We don't want to be hanging out there. So so that's why it's always good to work with like a functional medicine doctor, or someone that is
Right.
really going, okay, here's the numbers, but what does that mean?
Right. Okay. Very cool. Can you share a story? I know you've been doing this a long time, but we always love our physicians to share a story about a patient whose life that you saw significantly improve using your system.
Yeah. Well, I love the guy that this protocol was born for one particular patient. And it happened right after. And the reason I'm such a passionate nut about this, Ginger, is that I actually stressed myself into being pre-diabetic. So before this patient showed up, I had found that and had to do a deep dive and reverse that in myself, right? So and before you get any ideas, I was working out 5 days a week. I was doing the ice bath, I was doing the meditation, I was doing the whole foods. I was like your good girl naturopathic doctor, and I did stress myself into being pre-diabetic. And of course, for me, that was a pivot point and not a neurotic breakdown point. So one of the things I had to do was also go, okay, besides the physiological part, because I knew it was fueled by stress. I'm a single mom. My son is autistic. I ran a medium-sized business and basically did everything, my whole life by myself, right? And so I had to say, okay, where am I burning the candle at both ends, which was like everywhere? And how can I unplug this? And how can I start saying no? And how do I need to change my life if I don't want to keep going down this road? And that was just as important as the deep dive on the physiological stuff. So that's the pre-rant on. So then I already had this experience, and I understood what was going on here with the metabolism for people that looked like they were fit and healthy,
Right.
And this guy actually was he didn't look fit or healthy. And he was probably one of my, like most naughty patients. He would show up once a year and, kind of want to do something maybe and not do any of the lifestyle advice, oh, no. I just have to eat what my wife cooks for dinner. I'm like, oh, okay. And he had been told that he had to put stents in his heart. And that's really scary, right? For most people, we'd be like, okay, wow.
Yeah, that sounds serious.
But luckily, in this case, this guy has a really strong personality. And he said, no, thanks. I don't think so. Give me 2 months and then let's see where I'm at. And so if we don't learn anything from hearing from me today, it's that you could do that. If you're not a hot mess falling apart and something like that happens to you, You could say, can I have 2 months? And then find someone like me, find another functional medicine doctor, because the best thing to do would be to really show up, and try to reverse this plaque and inflammation. So that was really cool that he showed up and he said, and I know I never listened to you, but I'm really serious right now. So I said, okay. And I was really present.
We did everything you said for 2 months.
Yeah, for the first time ever, in years. And so I was really present with him, and I had just had that pre-diabetic reversal myself. So I said, this is what we're going to do, right? We're going to do X, Y, and Z, and we have 2 months. And he showed up and he did the detox, and he did the glucose balancing and the health coaching and the calcium balancing therapy and certain IV therapies. And by the end of it, I was really surprised when he said, oh yeah, they excused me from needing the stent surgery. I was like, wow. I was like, okay, note to self, this is a really great protocol, especially if it worked great for him, right? Because some people come at different health baselines, but he really, he wasn't really trying before he decided to try.
So what biomarkers, just if you can share with the other clinicians that might be listening, like what biomarkers went down in order for him to not need those stents anymore?
Well, in this particular case, they're literally looking at the plaque, right? Like in the arteries, right? And then if you don't know this is since I've started working more in this, because it became repeatable, I didn't realize that whenever they put the stents in, it actually makes the body want to make more inflammation and more plaque. Which is more motivation that if they're telling you they want to do this, that you might want to think seriously about doing some kind of holistic program to unwind that, because then you're going to have to be even more on top of it once they put the stents in, which would make sense why we hear from these people that have had 11, even 20 stents. I mean, you're like, wow, okay, I guess, the stents aren't really holding up that good. And then obviously what we do work on is inflammation, insulin, and glucose, right? So those are simpler things to look at that would tell you that. And then for him with the heart, you got today, we didn't have this then, right? You can do those clearly scans, right? And the thing, I always like to look at the carotids as well, because that's another place where people like to stack plaque. And that can just be done with an ultrasound. And there's a company, maybe you've heard of, called Lifeline. So cool. They're all over the country, and they'll do an ultrasound of your heart, your carotids, EKG, all this stuff. And it's like $200. So anybody that's paying out of pocket, check out Lifeline. This is a great, out of pocket opportunity to just kind of know what's going on there.
Right.
Mm-hmm.
And so how long have you been practicing naturopathic medicine?
Yeah, I think I'm going on 12 or 13 years in naturopathic medicine. Mm-hmm.
And what was some of the challenges that you faced when you started in your practice?
Oh, let's see. I mean, all of it, really.
You weren't as respected as you are today. Let's put it that way.
Oh, there was so much education that we had to do 10, 12 years ago, right? Because now everyone kind of knows that they should detox, right? It wasn't like that like 10 or 12 years ago. People were like, okay, why do you want me to do that? Like, this is a natural what are you? So it's like we're in a totally different world now. And I love that. And also at the same time, it's even more toxic of a world, right? So 10 years ago, I was begging people to do a detox once a year, right? Now I'm insisting that the people that work with me do a detox quarterly, right? Because it's just like everybody's more inflamed. There's more environmental things. I've found, and maybe other people that you've talked to have found since the pandemic, people's blood is just thicker, stickier, like more clumped together. So
quarterly detox. So quarterly. Okay.
Mm-hmm. Yeah. Cause you can do a lot of damage in 3 months, or you can turn your whole life around in 3 months,
So what does that detox look like? Is that a fasting detox?
Compliance is key, right? So I do this herbal detox. So it's usually nothing but wins, right? More energy, better bowel movements, better blood sugar, better blood pressure, more mental clarity, less inflammation. And then as they're going, oh, hey, like this is working for me, then I give them the list of the nutritional detox, because there's going to be things, you probably are guessing some of them, that we want to take out to lessen the body burden and inflammation for a couple of weeks. And there's always going to be at least 1 to 5 things that they're not having happy about on that list. So that's why we start with the herbs and just start with the wins, right? And then we start with kind of intermittent fasting and circadian living, where we don't want to be eating or working out or working when the sun goes down. So the body just starts working better. And so now we have some buy-in, so they'll be willing to give up their coffee or their booze or their cheese or whatever it is that they're upset about, for 2 weeks. That's it. I just ask for 2 weeks, but 9 times out of 10, they leave it out, and then it just trickles back in, because they think they can't live without it. But then once they turn the corner and they're feeling so good, they're not that desperate to bring it back in. But eventually, because we're not perfect, and maybe we do like having coffee or whatever it is, then it comes back in. And so it's always good to do that reset, and that it's just kind of like balancing your checking account or organizing your email box. I mean, it's even more important than all that, because it's like your living human, battery.
Right. No, I love that. That makes sense. So getting back a little bit just to the kind of the business of medicine, what strategies have you found that have helped you to build a successful practice?
I think that what you might want to know is that when I found myself to be pre-diabetic and realized that I had been on for decades and it was catching up with me, even though I handled it with grace, from the outside, everyone would think I just had it so together. I decided that I needed a total change. So I went from having a full-time medium-sized brick and mortar holistic healing center. I just literally shut it down, moved cities, right, to be at the beach so I could go to the beach more. And I did not have a plan. I literally went in with blind faith. Everyone thought I was insane and I did not care what they thought. And I shut it down and I went to the beach and I just knew that everything was going to work out for me. And I had no idea what I was going to do. And everything kind of did. And we already had this protocol. We had already helped many people with this protocol. And I have a lot of interest, right? My son's autistic. That's like, like an ooey gooey spot for me. Like, I'm like, oh, maybe I want to work with, neurodivergent families.
Sure.
And I mean, we all have so many passions, but this one kept wanting to get born, and it just gave birth to itself. And I didn't realize that I could work with people all over the country on this. And there had been a push from other groups that I had been to do one-to-many, right? And so I just said, well, kind of screw it. I'm going to just try it. And what I found is like, through making it like a program, right? And it was confusing for me because of the different models that I had. I didn't have a model for what I do, right? There was online and there was brick and mortar, but I'm hybrid, right? So I kind of got stuck in like that because I didn't have anyone to model after, right? Because part of the healing that we get, that these people get rid of their plaque and heal their heart after having a heart attack, they always do these really cool IVs, right? And they don't have to do a lot of them. I only had them in clinic 5 times, all these people that got these killer results. But I didn't want to offer the program without that option, because I saw the healing that it gave people. Right. So I had to figure all of that out, but it was just like, it wanted to be born, right? It was just, I remember the lady that said, I want to work with you, but I live in Florida and I don't want to travel to Scottsdale. Can't I just do it without the IVs? And then I was like, yeah, she can. And you know what the funny thing is? So many people have done that and they have like weaned off their meds, lost weight, been able to go from barely able to check their mail to go on a hike with their family. And this is even without the IV part that I thought they totally needed, so that we could help people all over the country. And the other thing that I found was other people that were more serious or already had a major event, they had no problem traveling for those 5 visits to come see us in Scottsdale, so that, and I guess the thing I would say, it was just realizing, just because things have been done a certain way, that they don't have to be that way, just kind of being open and trusting the process, it kind of having to I kind of had to get out of my own way, I guess, because I was limiting what was possible.
Yeah, that makes sense. Sure. Yeah, no, that does make sense. So that was going to be my next question, is kind of what advice would you offer, to other clinicians that are just beginning their journey, either into functional or integrative or naturopathic medicine? A lot of them now are my MDs and my DOs that are really wanting to add these fellowships to their repertoire. What advice would you give them?
Well, you know what? And this is hard for me because I'm a total Renaissance lady, but it really helps to just focus on one thing and focus on that first and just do that, right? Like pick your prize pony and love that pony, right? And that is going to help. And then also you've got to get away from the one-on-one, because compassion fatigue is real and you will end up hating your life and all of your patients. Like, it's true. Like, I talked to all of the people I went to school with, and like it catches up with you, right? Because you're over giving and then you're pouring from an empty cup, right? This cycle of energy is an imbalance.
So you're recommending to get away from the one-on-one clinical protocol to more of a one-to-many, design a program that can be rolled out to many.
Yes, it's going to save your sanity and it's going to keep your passion for your work. And the people actually do better if you make it into a program, right? They're going to show up. They're going to share things that worked for them, that they learned. They're going to build community. They're going to feel like they're a part of something, right? Because everything is so isolated these days, right? That can be part of the problem too. Because remember the saying, "It takes a village." Well, now you are the village. That's why you're stressed out and have high blood pressure and anxiety, because like you're the whole village.
I love that. So you don't do any one-on-one anymore. You're just strictly doing.
We do one-on-one. We do one-on-one, but like, let's say they'll get in a 6 months program, they'll have like 2 to 3 private consultations depending on their package, right? And then they have a health coach, they have the group calls, they have the group meditation, they have the online thing, and we do special things. Like I said, today we're all doing a liver cleanse together, right? And I think a month ago we all did a parasite cleanse together, and so there's the momentum from all of that, And honestly, I find the people that do the best, they show up to all the classes, they show up to all their coaching calls, and sometimes, people just aren't ready. I mean, I have people that sign up and never come to anything.
So, from a naturopathic doctor perspective and kind of seeing what's going on in the functional and integrative medicine world, and, all of these worlds kind of coming together and supporting one another now. And even the MDs and DOs now are joining in, and we're all playing nice in the sandbox, to help people really heal. I think there's a real big movement now that, it's not just about treating symptoms anymore. We really want to help people heal. And I love that. What are the trends that you're most excited about that you're seeing coming down the pike? You noted circadian biology. I know that's becoming a real big topic now. My sister's a mitochondriac living down in El Salvador. So what's exciting for you right now? The peptides, the red light, like what's one thing that you're looking at and you're like, this is something I'm going to be utilizing, or I'm looking at utilizing?
Yeah, I've been doing the peptides and the hormones for years, and I'm really glad that people are into it. But what we need to do first is like this basic stuff, like the detox, the insulin glucose balance, right? The circadian living, because then you have this really solid foundation. Because then that stuff is like, it's like your stucco and your paint on your house. But first we've got to build the house, and any woman that's not happy with her figure, hormones will help, but I'll bet you $100 there is a insulin resistance component there that we need to take care of, and that is affecting how well the hormones are working in the body. So, and I see that, and I love that, because I see people talking more about insulin resistance and the hormones, right, and the detoxing and the mitochondrial support, and I think that's key. Right. So I just decided I'm constantly evolving my program, because I'm just seeing patterns in people, and I'm like, we've got to add the mitochondrial support for our people, that don't know how to turn it off. I think that's key. And something interesting that you might see coming up is that I've just gotten more into thinking of the human body as just like a human battery, right? Like here I'm drinking my battery fluid. It's like salt, vitamin C, water, just to keep me charged. And then we have started doing colloidal gold, right? Which increases our conductivity, right? So you've probably heard of colloidal silver, which is really great for infections and stuff like that. And here's the thing, like, have you ever seen rusty gold?
No.
Exactly. But what is the metal that is in us besides the aluminum from the sky? It's iron. And when you think about iron, you almost immediately think about rust next, right?
Right.
So what we're doing is incorporating nanocolloidal gold every day and seeing how that can increase our flow and our energy and our thinking and everything like that. So I think that we might see. I'm just having more of a love affair with the precious and semi-precious metals. Like I've got all my copper bracelets,
Love that.
things kind of cycle back in, like I was into this years ago, but I'm just feeling more about like the resonance and the conductivity, right? And all of this is going to work better with that other stuff. If we're less inflamed, if we're not eating all day, every day,
Right.
if we're well rested, but then it's about just keeping this battery, flowing. Like, have you heard, this one keeps coming up in my like For You pages about how the heart isn't really just a pump. It's more of like a spiral energy source for the whole body.
I did not know that.
Yes. So I feel like this is the future, is thinking about us as a human biochemical battery and what's going to help us be more conductive. I think that's the future.
I love that. I love that. All right. So tell us, what is the best way for people to reach you? First and foremost, clinicians are you doing any kind of training on the clinical side for other clinicians, or strictly just working with patients?
So that would be on a case-by-case basis. Now we want to do that further on. Right now we're just busy working with patients, but people can reach out to me if that's something you're interested to.
Okay.
Because it's literally so easy. And then we can redefine retirement for our parents and for ourselves,
Right. I love
and
that.
it's repeatable. But just hit me up on social media. I'm on Instagram, TikTok, Facebook. It's Dr. Mel Holistic with the HOL. Dr. Mel Holistic. And we just started getting on YouTube. So that's ITS Dr. Mel on YouTube. So those are the best ways to just send me a message. If you're curious, like, what is this Biohacked Heart Blueprint? We do have a complimentary masterclass that's 20 minutes long. It's not too long, on the website. And that's Dr. Melanie, Melanie, Icard.com.
Okay, awesome. Well, thank you so much for taking your time to be on the show today. You've been a pleasure, and you just glow with health and energy. So whatever you're doing, we all need to be following Dr. Mel. So thanks again for being on the show today.
Thank you, Ginger.
Bye.